travel sickness, but that woozy feeling can also strike during seemingly fun rides at the amusement park.
Oh, we are talking about motion sickness today. To help us understand it better is Dr. Ruen, consultant, ear, nose and throat surgeon from Mount Elizabeth Hospital. Good morning,
Good
Doctor.
Good morning, Doctor.
Welcome to the show.
Good morning. You've mentioned various forms of motion sickness, but what actually is it? How does it come about?
Well, motion sickness is due to a sensory conflict between what the brain has been told by the body and what the eye actually perceives. So let's say if you're on a moving car and you're not looking out, but the body's moving forward, but the eye is not telling you that you're moving forward, then you have motion sickness.
I see.
So it must be visual. Is it dependent on the visual that it doesn't sort of coordinate, and is that why? So if my eyes are closed, for example, can I still get motion sickness?
It will make it worse.
Oh.
Actually, it's a sensory conflict. So sometimes it could be because your body is moving, but or the body is not moving, but the eyes is perceiving that you're moving. Let's say in an IMAX theater, you might also get motion sickness.
Okay, so what's actually happening in there? I believe you've brought in a model, so can you explain to us what actually happens when you get motion sickness?
That's right. When you have motion sickness, the hindbrain or the inner ear, the semicircular canals.
Yeah, so I mean, what you're saying is, okay, you've got we're just going to show some footage of you in the clinic now, but we're going to cut to a shot of what the diagram you have in your hand in just a minute. Before we get to that, tell us what it is you're doing now with the patient. In this picture here, are you giving her a test for motion sickness, or?
This is a general test for people with imbalance. We usually test the cerebellar system, which is the hindbrain, and we test the vestibular system, which is the inner ear, and we test all the cranial nerves, and then we go down to testing the ear. So in this particular, just now, we were testing the vestibular system, where we're testing her to see whether she can coordinate the hand movements, and right now we're looking at her cranial nerves to see whether she has double vision as she follows my finger.
Okay, so there are ways to test whether you are more prone to motion sickness. Is that the purpose of the test?
Yes, that's right.
Okay, and are there more people that are prone to it than others? When you consider gender or age or, I don't know, medical circumstances?
Definitely. The young, the female, or the infirm may be more prone. The young because the balance organs may not have fully developed. The female because of hormonal changes. And the infirm because maybe the balance organs may have started degenerating. So they may not be able to take motion that easily.
Well, we're going to ask you now, you have the sort of the model there. Tell us how the system sort of works inside. That's sort of our eardrum area, is that correct?
Yeah, this is a model of the human ear, about 3 times enlarged. And this is the external ear canal, the eardrum. The middle ear with its bony little bones inside there, and the inner ear. There are 2 functions in the inner ear: hearing and balancing. Hearing is from this cochlear nerve, whereas balancing is from the semicircular canals. And if you have motion sickness, that means you either detect fast movements or irregular movements or erratic movements by the semicircular canals. And the semicircular canals are in 3 different planes. So that means forward movements, sideward movements, or tilting movements are all detected. And if there is a conflict of information that's detected by the inner ear, as opposed to what your eye actually tells you, then you would feel nausea and vomiting.
Well, I mean, they are some of the symptoms: nausea, vomiting, and also dizziness as well. How bad can it get, actually, any of those symptoms?
The moment you vomit, I think it's pretty bad already.
Oh, okay. So
But you always feel a lot better after you've done that. I mean, I don't know. When I've encountered it before, after you throw up, you feel a lot better, like you've kind of got back your balance.
Thank goodness, isn't it?
So how else would you recommend dealing with it there and then if you don't have any medication to deal with it?
Actually, I think back to the question of how bad can it get, I think whenever you have motion sickness, you look out for unusual symptoms, unprovoked symptoms, as well as unilateral symptoms and unconsciousness. Let's say if you actually have motion sickness like symptoms and then you fall unconscious, it could be because you're fainting. Vasovagal attack, hypotension. This is different from motion sickness. If it's unprovoked, then you're wondering why could it be unprovoked? Then you have to look for other causes. And unusual symptoms would be double vision, or it could be unilateral weakness of the body.
Okay.
All these, if it's accompanied by nausea and vomiting, I think it might mean a central issue.
Well, of course, we say prevention is always better than cure. So, are there methods to prevent getting motion sickness? I know there's some medication out there that people can take. I mean, what are some of the options available?
Yes. There are various options. You can have the oral medications, which take about half an hour for action.
Is that antihistamines, or are they different?
They're different. Things like Novomin, these are dimenhydrinate preparations.
Right.
They prevent motion sickness from starting.
Okay.
Or you can have transdermal patches.
Right.
Patches that take about 6 hours for onset, so you need to put it on behind your ear
Okay.
before the start of a journey.
Okay.
What about natural ways? Anything you can drink? Some people believe, I don't know, you take some ginger.
any grandmother's
drink yeah, in that sense.
Ginger, yes, ginger. Even scientists have been researching about that.
Yeah.
Ginger. And they think that large volumes of ginger can help you prevent motion sickness.
Is it
but
the
the-
placebo effect? Is it mind over matter, do you think?
Nobody really knows. They're trying to look for a scientific explanation, but I think it's a bit difficult to find.
And how is motion sickness different to vertigo? Can you explain the difference? Or is it
Well,
similar?
vertigo is this really specific and scientific term that tells us that you're spinning around and it's a sense of imbalance. Motion sickness is a form of vertigo.
Oh, okay.
Yes.
Okay.
But the other term that we often hear people talk about is dizziness.
Yes.
Dizziness is this non-specific non-specific symptom,
Yeah.
which may or may not be due to imbalance. It may be just this lightheadedness
Or low blood
this
pressure.
blurriness. Yes. Hypotension, hypoglycemia
Okay.
Right.
can give you
So
dizziness.
can you tell if some people are more susceptible to motion sickness? Can for example, I go for medical checkup now, are they able to discover that?
Yes, there are some people who are more susceptible. These are people with a pre-existing condition in their brain, their hindbrain or their inner ear. They're definitely more susceptible.
Okay.
Yes.
And that can be spotted. You can actually discover that when you speak to a patient and find out about it from them?
Well, usually patients come with us with the problem of motion sickness,
Okay.
but I think if you have a problem with the hindbrain or inner ear, you have more serious problems to deal about. Motion sickness is just one of the issues.
Right. Okay. Thank you so much for coming in. We've been speaking to Dr. Lim this morning, talking about motion sickness, which can often hit us when travelling. If you're prone to it, you may want to take some precautions and visit your healthcare provider before setting off.
Coming up next on the